Good afternoon, everyone. My name is Kate Watt, and I'm the Executive Director of Komen, Florida. And I'm joined here today by Dr. Rimmer, who is the Medical Director at the Breast Center at Good Samaritan Hospital, which is the home of Susan G. Komen, Florida. And we are so pleased to have you here today.
Thank you very much.
We're really excited to talk about this topic because we get a lot of questions about it, and I think there's not a ton of information out there. We've had a lot of men that have called us. So we're going to be talking about breast cancer in men. So there are nearly 250,000 diagnosed cases of invasive breast cancer in the U.S. every year. We lose about 40,000 plus people to breast cancer every year. But about 1% of those cases are male.
Right.
So talk to me a little bit about how breast cancer is detected in men.
So, breast cancer in men is kind of considered the second cousin of female breast cancer.
Mm-hmm.
And, men, sometimes you see a man with a breast cancer and they kind of feel neglected a little bit. Every now and then when we see a man with a breast cancer, they often end up in a diagnostic facility in a waiting room surrounded by women, which is not in itself a bad thing.
No, I know. I've had text messages from some of them sharing that they're in the same area, or sometimes they're sort of segregated in other areas.
So they feel a little bit out of place.
Yeah.
And the reason they feel out of place is that breast cancer is quite unusual in men. It's not something that's in the media all the time. It's not really talked about very much. So the fact is that breast cancer in men is somewhat unusual. We do see it. And breast cancer in men is usually diagnosed with a mass that they feel. Men don't really do breast self-exams like women can do, but breast cancer in men usually presents as a mass that they feel in their breast area.
Sure. And so if they notice that, what's the first step that they should take?
So if they notice a mass in their breast area, they should go and see their doctor, probably their primary doctor first. And the primary doctor can either send them for a mammogram and ultrasound. We do mammograms and ultrasounds in men. We don't do screening mammograms in men. So if a primary doctor is the first person to see the patient, then they would refer them to a doctor who specializes in breast cancer.
And what are the survival rates for men with breast cancer? Are they similar to women?
So, generally speaking, we would say that stage by stage, the breast cancer survival rates are the same in men as in women. There are some recent publications that say that sometimes the disease is different in men than women, but generally speaking, most people would say the stage by stage of the survival is the same.
So if you're following on Facebook and have any questions for Dr. Rimmer, just send those through and we'll be asking your questions here right now. But I still have a few questions because we do get a number of calls from men that have discovered a lump on their breast and are not sure what the next step is, or have gone to see a doctor and the doctor doesn't see it very often and they're not sure what they should do next. But talk to me about some of the risk factors. We certainly talk to women about what the risk factors are for breast cancer. Are they the same for men?
So in men, the risk factors tend to be associated with factors like estrogen exposure. And a man's estrogen levels can be affected by things like liver disease, alcohol, medications, some genetic conditions like Klinefelter syndrome, which is a disease or abnormality of the testicular function, so that it doesn't make the normal hormones. Family history of breast cancer, that tends to lead you into the genetic mutation category and the BRCA situation. So that changes in the man's hormonal situation, which can be diet related, alcohol related, obesity related. Those would be recognized risk factors for breast cancer in men.
So if someone has a family history of breast cancer and maybe has someone in their family that does have BRCA1 or BRCA2, should they consider genetic testing?
So we've learned a lot about the genetics of breast cancer recently, and there are two gene mutations, particularly with the Angelina Jolie story that hit the press a few years ago.
Sure.
there's the BRCA1 and the BRCA2 gene mutations that are associated with the familial breast and ovarian cancer syndrome. Typically, the BRCA2 is more associated with breast cancer in men than the BRCA1. So how do we identify these patients? We identify them by looking at their family history of breast and ovarian cancer. Both BRCA1 and BRCA2 are associated with a strong family history of breast and ovarian cancer.
Is that a discussion that they're having with their primary care physician, or is it something that they should almost advocate for themselves?
So genetics is a discussion we have a lot more in women when they attend for their mammograms, and we try to assess their risk factors quite carefully on a regular basis, often when they go for their screening mammograms. So that doesn't really happen in men. Mm-hmm. If you compare a woman who has a BRCA1 or BRCA2 mutation, deleterious mutation, that can be associated with up to an 85% lifetime risk of that woman getting breast cancer. If a man has a BRCA2 mutation, his risk of getting breast cancer may be 1 in 12, 1 in 8. So a man can have a gene mutation and not get breast cancer. The chance of him having breast cancer with a gene mutation is lower than a woman's with the same mutation, so he can have it and not get the breast cancer. So we often see that in women who have inherited a BRCA mutation from their father, mm-hmm. and that's a different scenario than when a woman inherits a BRCA mutation from their mother. Oftentimes the daughter will know that her mother had breast cancer when she was young, but the father wouldn't have had breast cancer. It may be that his mother had breast cancer or his sister had breast cancer, but with family dynamics, maybe the patient doesn't see it. So it's not something that often men don't really think about, genetic mutations, particularly BRCA1 and BRCA2.
So we've done a really interesting couple of Facebook Lives on genetic testing and understanding genetics and what's available here at Good Samaritan Hospital. So if you're out there watching and you do have more questions on that, I would definitely encourage you to take a look at those Facebook Lives. I know that they were super helpful for me and for others, but it's something too, I think that, if you're a male who does have that family history, you are aware of it, that you should consider and probably talk to your physician about.
So it's something that comes up on a regular discussion when we're talking to a woman who may have an early breast cancer diagnosed at a young age. Mm-hmm. And she may have inherited it from her father. She may have brothers, and obviously we think you should talk to your father and your brothers and your sisters about being tested. Oftentimes we see that people are sometimes not interested in getting tested, which is when it comes to genetic testing, it's quite difficult to understand why some people don't see things the way you think they should see things.
Sure.
Some people just don't want to know.
Yeah.
Some people do want to know.
Yeah.
For example, if a man has inherited a deleterious BRCA mutation, he can pass it on to half of his children. So if he passes it to his daughter, she has an increased risk of breast cancer and ovarian cancer. If he passes it to a son, his son can pass it to his children. So it's important for men to know about it.
Yeah, I agree, and I appreciate you sharing that message, because I think when we've talked about genetics in the past, we've only talked about it from a female perspective and certainly not from a male perspective. And I have known men who have had a significant family history and have gone ahead and done the genetic testing because they have children, they have sisters that have been diagnosed, and it really makes a lot of sense to know that information.
I saw a 34-year-old lady yesterday who's just diagnosed with a locally advanced breast cancer. And we asked her, do you have a family history of breast and ovarian cancer? She said no. So when you talk to her in more detail, it turns out that her father's brother was diagnosed with prostate cancer aged 40.
Wow.
And right there, that's an alarm bell. Being diagnosed with prostate cancer aged 40 is very young. A BRCA2 mutation increases a man's risk of getting prostate cancer. So you could look at that and say, her father's brother may have had a BRCA mutation. Then asking more detail, that man's daughter had breast cancer diagnosed around 40.
Wow.
So this only came to light when she came to see me and we started talking about her family history. Up until that point, she was really unaware of the significance of her family history.
That's so interesting. You talk about young people being diagnosed. Do you see more younger men being diagnosed with breast cancer, older men being diagnosed? Is there, I don't know what the average age for a male breast cancer diagnosis is.
So it's about 60.
Okay.
So despite the fact that we talk about genetic mutations in men with breast cancer, most men who are diagnosed with breast cancer don't have a genetic mutation. The average age of diagnosis of breast cancer in men is in the 60s. So we tend not to see young men with breast cancer, we tend to see older men with breast cancer. So just going back a little bit to the questions about a man with a breast mass, for example. The commonest reason a man has a breast mass is what we call gynecomastia.
Okay.
Gynecomastia is a benign condition that we see in young men and older men. In young men, it can be a hormonal change, and in older men, it's often related to medications, for example, prostate medications. That's a more common cause of a palpable or a mass in the breast that a man can feel. That's typically right behind the nipple areola in the center of the breast. And if you do mammograms and ultrasounds on those patients, the appearance of a mass on mammogram and ultrasound is very characteristic of it being a benign mass rather than a malignant mass. So we do see masses that are palpable in men, and the majority of them are benign.
Interesting.
Gynecomastia.
So Pat just joined us. Welcome, Pat. Thanks for joining us. I know that this is an issue that you are very active in advocating for and educating and increasing awareness. So we're excited to have you on Facebook Live right now. We've talked a little bit about symptoms. We've talked a little bit about risk factors. Certainly genetics, but what does treatment look like? Is there any differences in treatment for male breast cancer or female breast cancer?
So, bearing in mind that breast cancer in men typically presents at a later stage than in women. In women, we like to diagnose breast cancers when they're small and you can't feel them, so that they're typically an early stage.
And that's because of annual screening.
Screening mammograms.
Yep.
Right. So you could think about the diagnosis of men now in this age being similar to the diagnosis of breast cancer in women before we had screening mammograms. Before we had screening mammograms, women presented with a mass in their breast, and nowadays they don't.
Right.
Tend to, if they get screening mammograms. The men would present with a mass in their breast, so often men will sit on that mass for a while and just watch it grow. So it tends to present as a later stage, maybe a stage 2 or stage 3. So the treatment of breast cancer in men is very similar to the treatment of breast cancer in women. Generally speaking, often in women, when it comes to surgery, we often think about breast conservation or a lumpectomy or mastectomy, depending on multiple factors. So in men, men tend to have smaller breasts, and the operation tends to be a mastectomy.
Okay. Okay.
The medical treatment often involves tamoxifen. The majority of breast cancers in men are estrogen receptor positive. A lot of men don't need chemotherapy. They often do need tamoxifen, which is an estrogen receptor blocker.
Right.
If you do a mastectomy and the lymph node in the axilla is involved, then they may need radiation. Often if they have a local recurrence or they have metastatic disease, they may need chemotherapy. So the principles of treatment of breast cancer in men is the same or similar to the treatment of women.
Does immunotherapy help in the battle as well?
So immunotherapy is a relatively new type of treatment for breast cancer, and immunotherapy tends to have more of a role in the triple negative breast cancers. Men don't tend to get triple negative breast cancers.
Okay.
So it's not something that is a major
Can you explain
part.
what triple negative breast cancer is for those that don't know?
Yeah. So we talk about the tumor markers when it comes to breast cancer. The tumor markers are the estrogen receptor, the progesterone receptor, and the HER2 new receptor. Those receptors, each of them can be positive or negative. So if you have an estrogen receptor negative cancer and a progesterone receptor negative cancer and a HER2 negative breast cancer, that is a triple negative breast cancer. Triple negative breast cancers are a more aggressive type of breast cancer. And because they don't have a receptor that's present on the cancer cell, we don't have what we call a target for the treatment. Targets for treatment would include the estrogen receptor and the HER2 receptor. So we have specific treatments for the estrogen receptor, which is hormone blocking drugs, and the HER2 receptor, which is Herceptin and Perjeta. But we don't have specific targets for the triple negative, so they tend to get generic, non-targeted chemotherapy. And in those patients, after they've had conventional chemotherapy, they sometimes require newer treatments, which include the immunotherapy.
So Pat just shared that her husband is a 6-year breast cancer survivor. He was tested for BRCA gene, but he did not have it. And her husband actually frequently speaks and educates men about risk factors and how to identify it. What would you tell men about being active in advocating and noticing their own changes in their breast health?
So I would tell them that obviously it's important to know your family history, and obviously if you feel a breast mass, act on it early. Go and see a doctor. If the doctor you see doesn't seem to be doing appropriate measures, then find somebody who takes care of breast cancer and go and see them. You know, the earlier you bring this problem to medical attention, the earlier the stage, the less aggressive the treatments, the better the survival. In men who have a BRCA mutation, we don't tend to do risk reduction surgery. So a woman with a BRCA1 or a BRCA2, oftentimes we'd think about doing risk reduction mastectomy and or removing their ovaries. Because they have the mutation, their risk of breast cancer is high.
Right.
In a man with the same mutation, his risk of breast cancer is higher than a man who doesn't have it, but it's not to the same point where we do risk reduction mastectomy on those patients.
So does a physician follow? Is it a clinical breast exam? Do they have frequent mammograms? I mean, what is it that you do?
You're talking about a man with a BRCA mutation.
Right, with a BRCA mutation.
So, you know, you think about their cancers that they're more likely to get, which includes breast cancer, prostate cancer, melanoma, maybe pancreatic cancer. So you do, you know, in men you can feel masses pretty easily, so you know, you do a breast exam. They need to see a dermatologist, they need to see their urologist, maybe getting screening PSAs.
Okay.
And you know, you think about all their cancer risks, not just their breast cancer risk.
Well, it is Men's Health Month. We've been talking about breast cancer in men all month at Susan G. Komen, Florida. The work that we do is not only to support women with breast cancer and screen women with breast cancer, the same thing is done for men through our organization. And one of the options I wanted to share with everyone today is that we do have a treatment assistance program in Florida. And if you're battling breast cancer and are in need of financial assistance, you may qualify for this treatment assistance. So you can call 1-877-GO-KOMEN, or you can visit us at KomenFlorida.org to learn more. I want to thank Dr. Rimmer for joining us today and for talking about this important subject. We really do get a number of calls from men who are concerned about a lump in their breast. We want to make sure that that information is out there. So I hope if you're watching, you'll share this with anyone who may need it. And we're very thankful for having you here today. And we look forward to our next Facebook Live. So thank you all for joining us.
Thank you very much.